I'm always sort of happy to see Friday like most people, but I'm looking at the numbers, Vlad, that we are looking at in terms of COVID-19, and it's stunning. We are absolutely going in the wrong direction, and it's sort of disheartening sort of every single day to be chronicling the deaths, chronicling the new cases, and wondering just how are we going to turn this thing around?
Anne-Marie, it's such a good point. I can only say from experience here in New York City, which was for the early days of the pandemic, the epicenter of the pandemic, where we were in this period where we were seeing the infections rising across the state, and then we started to see the death toll. And it was, I think we talked about this during that moment where here you would constantly hear sirens, ambulance sirens. It never went away. It was sort of almost like an always on, you could always hear it, and it was so heartbreaking. And when you look at these numbers, when you look at the trend over the last just 3 or 4 weeks, when you look at the information that the Vice President of the United States, Mike Pence, 1 month ago, the
Supreme Court Justice Ruth Bader Ginsburg has been receiving chemotherapy since May to address a recurrence of cancer. Let's bring in our Supreme Court analyst, Joan Biskupic. She's on the phone with us. Joan, we were worried the other day, a hospitalization for an infection, and now we're hearing that she's been in chemotherapy for months.
That's right, John, and I hope you can hear me clearly. She told us on Friday that her cancer had reemerged, and she had been undergoing chemotherapy since May at the most busiest time of the recently completed court term. She told us all in a statement that she is tolerating the chemotherapy well and is encouraged by the success of the treatment so far. She said, quote, "I have often said I would remain a member of the court as long as I can do the job full steam. I remain fully able to do that." And she did demonstrate that at the end of the term, but I have to say, John, this obviously is worrying. She said she began the course of chemotherapy after a biopsy revealed some lesions on her liver, and the most recent hospitalization to remove the gallstones and treat an infection related to a stent were unrelated to this recurrence. As you know, John, she has a history of 4 prior cancer ordeals. She was treated for pancreatic cancer last August. In the prior December, she underwent surgery to remove 2 cancerous nodules from her left lung. In 1999, she successfully underwent surgery to treat colon cancer. She was treated for early stages of pancreatic cancer in 2009. As I said, there was a recurrence last August. She is regularly checked for cancer. In fact, when I sat with her in her chambers in January of this year, she told me she was cancer-free. According to her statement, it was a scan in February that revealed that was then followed by.
I am now joined by Dr. Melendez. Also with me is Dr. Bernard Ashby, a South Florida cardiologist who's been treating COVID patients. Dr. Melendez, let me begin with you. You are also quoted as saying, "I cry every day." I want to talk to you a little bit about what you're seeing on the ground there in Hidalgo County.
Thank you for having me this morning and allowing us to voice what's going on in our community. We live in a community of 1.2 million people in an area that's approximately 35 miles long, and we are traditionally first and second in the country with per capita diabetes, as well as morbid obesity, and among some of the poorest areas in the country. So we have some significant challenges that other communities may not. Because of our proximity to the border, in fact, some of our communities are on the border, and it's not unusual to hear gunshots from the cartels intermittently. But also because of our regular state of health with such morbidity and diabetes, we have some special challenges. Currently, we're at a point where we are in a dire situation, have passed a safety point, to be quite honest with you. We went from approximately 8 to 10 patients in the hospital before we had an opening of the community to business. And now today we have 911. We went from 2 or 3 people on ventilators. Now we have 140 today. We have over 200 people in the ICU. And what the most interesting fact about us, I believe, is that it took us about 3 months to get to
Shaq, I remember when the Democrats picked Milwaukee, it was to send a message about Wisconsin and Michigan, those states that they lost in 16. But for Milwaukee, it was a chance to sort of, reflex its Midwestern big city muscles here a little bit, getting out of the shadows of Chicago and your Detroits and things like this. So it's got to be a big blow to the folks that we're hoping to really lift up Milwaukee's presence and brand on the national stage.
That's exactly right, Chuck. And it's not only the city of Milwaukee that invested heavily into this convention, but it's the thousands and thousands of dollars spent by the small businesses who are expecting an influx of people. But the problem is, as the coronavirus and the cases continue to surge nationally, that is especially true here in the city of Milwaukee. So officials are saying that they'll remain flexible as they get into their planning, but they know that instead of having that large-scale convention that attracts about 50,000 people, they're saying the mood and tone on the ground, at least for this convention, will be small and intimate.
The Democratic National Convention, traditionally a time for assembling the rock stars of the Democratic Party. A coming together of thousands of party leaders and delegates in a series of history-making moments. And an economic boon to the host city. That's why Milwaukee was so excited when it learned it had been chosen to host this year's coveted DNC.
This will be the first time in the history of the state of Wisconsin that we are hosting a major political party convention.
But then came the pandemic, prompting the DNC to postpone the convention from July to August, followed by an announcement that the convention would largely be virtual. Then last month, word from DNC leaders urging most delegates to stay home. Milwaukee Mayor Tom Barrett says he's still uncertain what the convention will look like.
I'm confident that there will be a convention here, obviously a scaled-down convention. I'm confident that Joe Biden will accept the nomination here. Aside from that, I'm nimble. We were hopeful that there would be $200 million in spending. If we get a